Hi, I'm Helen Voronina. One of the most common causes of tooth loss is periodontal disease, commonly known as gum disease. But what if I told you that it's preventable? In this video, I want to show you how to brush your teeth. So many times I see patients who require their teeth to be completely replaced with implants due to this condition. I realize that most of us aren't taught how to care for our gums correctly. So if you do what I'm about to show you in this video daily, you can prevent gum disease. Gum disease is caused by bacterial plaque and tartar buildup on our teeth. If you have regular scale and cleans with your dentist every 6 to 12 months, and exercise good home care, you'll be keeping your teeth for life. Otherwise, you'll be coming to see me for implants. So here we go. So the first thing to know is that plaque and tartar build up right around the gum line, right around the neck of the tooth here. So when you position your toothbrush, you need to angulate it 45 degrees to your gum line, like so. Use very small, gentle strokes back and forth and spend about 3 seconds on each tooth. Next tooth, 1, 2, 3. 1, 2, 3. Time is important. Plaque is soft, so you don't need to scrub your teeth, but it's very sticky, and that's why you need to spend enough time on each tooth. What most people do is this. So they miss the gum line altogether, and that's why they get gum disease. That is quite a contrast to what I'm showing you. You need to angulate your toothbrush 45 degrees to your gum line. So all the way around, it's exactly the same technique that you need to use on your front teeth and the other side. On the inside surfaces of your teeth, it's exactly the same. You need to angulate your toothbrush 45 degrees to your gum line, like so. At the bottom, exactly the same idea, 45 degrees to your gum line, 3 to 4 seconds each tooth, and exactly the same thing on the inside. The only surfaces that are different are the inside surfaces of your front bottom teeth and front top teeth. The reason for that is because you can't get your toothbrush in this way. So what you need to do here is you need to use either the front of your toothbrush or the back end of it, like so. Once again, the idea is the same. You need to rub the neck of your tooth for about 3 seconds. 1, 2, 3. 1, 2, 3. And exactly the same at the top here. 3 seconds. You only need to do this once a day. You don't need to brush your teeth 2 or 3 times a day. But what's also important, actually before I move on to the next stage, I'd like to show you what to do with an electric toothbrush. So if you have an electric toothbrush with a round oscillating head, all you need to do is you need to angulate it 45 degrees to your gum line and hold it there for 3 seconds. It will oscillate and it will clean the teeth for you. Another thing that's also very important to do is to floss your teeth daily. What I tell my patients is that they should get a long piece of floss like this, fix it around the index fingers so that it doesn't slip off. Pop it in between the teeth, hold it against one tooth and rub the side of your tooth for about 3 seconds, and then the other tooth for 3 seconds. If your floss slides under the gum line, that's perfectly normal and it's okay. So each tooth, once again, one tooth a few times, each tooth, and the other tooth a few times. At the back, it's exactly the same. You just need to take a little bit of your floss with your middle fingers, and you use your middle fingers as a prop. You position it towards the back of your mouth like this, and I'm sorry, I just got bitten by this big scary model. So you position your floss towards the back of your mouth and you clean your back teeth like that. Once again, it needs to be done once a day. And the very last thing I want to show you is this little device that's called an interdental brush. You can get it from your local pharmacy, and they usually supply different sizes for different sized gaps. So what you do with this is you position it between your teeth, and by the way, this is for people with bigger gaps between their teeth. You position it between your teeth, and once again, in and out, you just clean your teeth like that for 3 seconds. In and out, it's like a little bottle brush, so it cleans between your teeth. If you have big gaps, you need a bigger brush. If you have small gaps, you need a smaller brush. That's it. That's all you need to do, once a day.